Okay, the tours will start right now.
Kevin, and I work in administration here. Welcome to the Beloit Health Systems Emergency Center. Come on in.
We got stuck in front of them.
Yeah.
Okay. Hello.
Yeah. How you doing, sir? Good to see you. Thanks for coming.
Thank you.
Get out of your way.
Okay, after registration, you'll come to this room. This is called Triage. Triage comes from a French word. It means to sort. Here's where we'll take your medical history, your vital signs, find out what brings you in that particular day, decide if you can wait to be seen or if you need to be taken directly to a room. In times of heavy volume, we do have an identical room next door. You can pull a nurse from the back and do double triage and speed up the process a little bit. Well, I have everyone here and we talk about medical history. Just as a side note, if you are on medications, it's always a very good idea to have a complete list with you, as well as current dosages. And just on a general principle, it's good to have that information anywhere because you never know what's going to happen. So if you could bring your list, that'd be great. After triage, we have a little sub-waiting room here for those that don't need to go right back. Otherwise, the nurse will direct you to a room in the back. Any questions?
Flex up, flex down based on the patient volume we have. We know that we're always busier on the weekends. We're busier on a holiday weekend. For example, this last 4th of July, the department worked fantastic. We're budgeted for, normally see around 100 patients a day. On the 4th of July, we saw 140. It's 40% more than you typically have. So the department worked great because we were able to have all the different areas staffed in anticipation of that, and our patients were able to get in and get out quicker. The department's really focused on patient satisfaction and turnaround times, and patient privacy and confidentiality. And you'll see that as we go into the different areas. So let's go down this way to the south.
This is our fast track area. This fast track area used to be our old emergency room. We had also
How are you? Good.
If you look into the rooms, they're all pretty much set up the same. They have a cardiac monitor at the bedside. They also have the doors do open up, so if we need to take larger equipment into the room, we can. They also slide closed. We also have a curtain to try and encourage more patient confidentiality. If you come around the corner here, it does go into a U shape. On the other side of this partition is the larger computer screen, part of our PAC system, where they can take a chest x-ray or any kind of x-ray in the patient's room, and within seconds the digital image will come up on the PAC system so the doctor can see it. The doctors and nurses and also physician's assistants are in this area. And we also have a tube system that looks a lot like a bank. What you can do is you can take our specimens that we get from patients, send it down to the laboratory. They can run the results and get them on the computer in a timely fashion. It now goes to the pharmacy also, so if we do not have a medication in our Omnicell, which you'll see over here, the pharmacy can actually send the medication via tube system to us.
And what the tube system does, again, is that focus on the patient turnaround, getting patients in and out for patient satisfaction. That eliminates the need for someone from the lab to come down to the department and draw a blood sample. Now the nurses or the staff in the ER can draw that and send it to the lab. They then enter those results into the computer, and it shows up on the computer station because we have an electronic medical record now in the department. So it's much more, it's cut the turnaround time for lab results almost in half. She had mentioned the PAC system. What that stands for is Picture, Archiving, and Communication Systems. All of your x-rays in the past, if you remember, you have the film where the doctors would put in a light box and turn on a light, and the light would reflect from behind it, and they'd be able to read that film. Now everything's on a digital camera. The digital technology that we have, as far as taking images of your body, it's just phenomenal. And it's great. The image quality is better, and the results get to the doctors a lot quicker. So the minute they take that picture, the doctors could be looking at the image on the computer screen, diagnosing what's wrong. And that will be our next stop, is the medical imaging. Exit sign that you see right here, and then the south wing that you were in, those were new additions to the hospital that were built. What's challenging about this project is we couldn't obviously close our ER and build a new one. We had to continue to operate in our emergency room for our community. So they actually built this wing that we're standing in first. They were practicing, as you'll see in the fast track area. We closed that and then moved over here and then renovated those areas. And the whole process was a logistical, they did a fantastic job with it. Because sometimes the contractors would be breaking up cement to do the renovations. But then when you have a trauma patient or someone who comes in, the nurses would have to run out there and say, stop, you got to stop doing that because we can't have the vibrations. And J.P. Cullen was the contractor out of Janesville, and they did a great job working with our staff and getting the project done. But it was a logistical challenge. Not bad.
What is that thing?
If you want to go in and file into the x-ray room. Just squeeze right in. I'll wait till everybody gets in here before I start. Hi, good morning. My name is James. I'm one of the X-ray and CT techs here. This is the X-ray room. The new X-ray room is located in the ER. It's a great help to me. It saves me a lot of steps of running back and forth between radiology and the ER department. It is a DR room, so it's digital radiography, which means a lot like your digital camera. As soon as I take the X-ray, that image is available for me to preview and send off to the doctor instead of having to take that film and take it in the dark room and process it and hand carry it over to them. This particular design room, I guess, was a first in the nation. And this here, excuse me, I'm sorry, I just want to demonstrate. This is the detector where you normally have like a conventional cassette or a cassette with a film loaded in it. Instead, we have a detector here. It has sensors that measure the amount of X-ray that passed through you, and then the computer is going to construct that into an image for us. I'm going to file back here, and if you want to come through here, I'll show you the control area.